Alex from Overland Park, Kansas writes, "My doctor has told me that I may have FAI. I've never heard of this before. Can you explain to me what this is exactly, and what are my treatment options?"
That's a great question, Alex. So FAI, or Femoroacetabular Impingement, is a condition that we're seeing more and more, and it's something that we're starting to understand people have had for a long time. We were not recognizing it. And now with new imaging methods and recognizing the symptoms more and more, we have an understanding of how a hip should be. We think that as you develop and you grow up and your bones are developing, the hip should look a certain way, the ball should be round, the socket should be deep enough but not too deep, and they should both be tilted forward by about 15 degrees. And if all that happens, you typically have a hip that functions pretty well. Now, if you ask your hip to do abnormal things like a ballet dancer or a hockey goalie, or if you do normal things but the anatomy is abnormal or the bones are shaped a little differently, then what can happen is with certain motion you can actually start to pinch the soft tissue between the bones or pinch the bones themselves, and that's where the term impingement comes from. So what do we do if you're one of the patients that has that? It's more common than we first or initially recognized, but as we see it more and more, the first thing to start with any condition is to try and see if we can get you through it without having to have an operation. So through a series of medications and exercises, sometimes injections, if we can control your symptoms and get you back on the field or get you back to activity, that would be the first thing to try. If we've tried all those things and you're still having pain and the symptoms just aren't better, the next step in some patients is to go to a surgical alternative, the mainstay of which at this point is to do either an open surgery with kind of a classic incision, or to do a minimally invasive surgery where we place a small camera through small incisions about the length of my pinky nail into your hip joint, and then with special instrumentation we can actually fix the torn tissue and reshape the bones that are causing the impingement. And often by doing so, that can relieve the pain and get you back to your activities.